to today's Marketplace. I'm Jane King. Today we're joined by Dr. Scott Shipman, the Executive Director of the Creighton University Institute for Population Health, and Dr. Kenneth Stein, the Global Chief Medical Officer for Boston Scientific. So welcome. Great to have you here. Dr. Shipman, let's start with you. We're all familiar with the complexities of the U.S. healthcare system. There's a large group of Americans that have access to great care, others that struggle to get the care that they need. Tell me about what the Creighton Institute is doing to improve this situation.
Great, yeah, thank you. Thanks for having me here today. So the Creighton Institute for Population Health is focused on addressing the factors that impede health equity in the population. Those factors include both access, outcomes, and quality of care in the healthcare system, as well as many community factors that impact equity or disparities in care.
Now, Dr. Stein, from what I understand, Boston Scientific has a Close the Gap initiative that addresses some of these unequitable outcomes. So tell me about that.
Sure, Jane. Boston Scientific, our mission is to improve, extend the lives of patients through innovative medical technology. And if there are segments of the population that don't have equitable access to therapies that work for them, well, then clearly we can't achieve our mission. And so about 20 years ago, we began an initiative called Close the Gap that's aimed directly at helping to remove some of the barriers that prevent underserved portions of our population, Blacks, Hispanics, women, from getting access to therapies that can make a difference in their lives.
And then you're also working with community leaders as well. So what are you doing from the community level?
We are. Community involvement is absolutely key to successfully addressing some of these disparities. I'll give you one example. In the United States, Black Americans are twice as likely as non-Hispanic whites to have amputation of their legs because of vascular disease in their legs. So we partnered with a large healthcare system in Baltimore to actually facilitate taking mobile labs to go out into the community and to screen people. It's had a tremendous impact in Baltimore.
And that your goal, or one of your goals at least, is to assemble a diverse group of people. But there are issues with language and sometimes mistrust of research. So how do you overcome those challenges?
I think the first really important thing, Jane, is to acknowledge and understand the reason for that distrust. I mean, when you look back at some of the things that went on historically, things like the Tuskegee experiment, right, where Black Americans were monitored without effective therapy for syphilis to understand the natural history of disease. There are really good reasons for folks in these communities not to trust. And so how do you build up that trust? It gets back to what you said earlier, right? It gets to being more involved with people in the community. It gets to including more people, for instance, from communities of color, more women as investigators in our clinical trials. It gets to actually reaching out and making sure we're including people from underserved communities in our clinical science so that we can prove that the therapies actually work for them.
Dr. Shipman, this is exactly the kind of work that your team is engaged in. So how does this new approach change the outlook to help improve the chances for equitable health care?
Well, I think that as a society, we need to recognize these disparities as a starting point. If we don't accept that health inequities are our baseline, we are unlikely to be committed to making changes. The work that Boston Scientific and others are doing is exactly what needs to be done. We need to study the problem. We need to measure the disparities. We need to work with the communities who have disparate outcomes to understand the root causes of those disparities and then act to make a difference.
And diversity in clinical trials is also a key part of this, correct?
Diversity in clinical trials is absolutely a key point, Jane. It's an unfortunate but recognized phenomenon that clinical trials of new medical devices, new drugs, tend to disproportionately enroll white male subjects. We don't enroll enough women in our clinical trials. We don't enroll enough Black Americans, Hispanic Americans, Asian Americans. And so Boston Scientific, we've got a key initiative to do better. And doing better involves, as I said earlier, making sure that we've got diverse people acting as the investigators in our trials, as on steering committees, designing our trials, but also means reaching out more to underserved communities. And we've actually run a number of trials where we've specifically focused on underrepresented minorities in our trials. And we've proven that if you do try to do it deliberately, you can very successfully enroll a very diverse set of patients in a clinical trial.
Okay, Dr. Stein, Dr. Shipman, thank you so much. Very informative.
Thanks very much.